Sanibonani Mora, and welcome to Good Morning Africa, your biggest and brightest breakfast show. Ongoing health, we'll be talking to Dr. Mohamed again about male infertility. We had a part 1 a while back, and now we're going to continue about male infertility. Thank you for joining us again, Dr. Mohamed.
Nice to be here again, Terry.
Thank you. My first question for you is, what is the most fertile time in a woman's cycle, or during a woman's cycle, I should say?
Usually it's on the 14th day of the cycle. But I mean, women differ, like everybody differs. So I would say that the most fertile period in a woman's cycle is between day 10 and day 16. I would consider that to be the most fertile. And day 1 is the day when the menstrual flow starts full swing. It's not just when there's a red vaginal discharge. It's when the actual flow starts. That's day 1.
Okay. And does Viagra affect infertility? Does it make you more fertile?
You're talking about a male, I presume,
yes.
eh? No, Viagra is medication for erectile dysfunction. And it has no impact on infertility. Although recently we've been using that in female in IVF, because what Viagra does is that it dilates the vessels. Okay, that's the action. It was initially used as a cardiac drug to dilate the vessels, or the coronary vessels, and as a side effect, they found that it caused erectile erections. It helped with erections because it dilated the vessels in the penis. But we've been also using it in the female to increase the blood flow around the uterine lining, so as to encourage implantation of the egg. So we're using it there as well in females, yeah. But essentially in the male, it's for erectile dysfunction.
Okay. What are the kind of problems that exist with sperm?
Well, you know, either you can have no sperm in the ejaculate, which is actually known as azoospermia, and there's various reasons for this. There could be obstructive causes or non-obstructive causes. And in a non-obstructive cause of azoospermia, usually is genetic or chromosomal. You know, for example, in a syndrome like Klinefelter's, one would have that. And then, if there's too little sperm, it's oligospermia. And if the movement of the sperm is not adequate or normal, it's astenozoospermia. And if the shape of the sperm is abnormal, it's teratozoospermia. Those are the labels that we give to the sperm. Sometimes all of these problems exist together, you know. So it's oligo-asteno-teratozoospermia, and there are various causes for this. And of course, you know, things like in the male, things like, well, genetics plays a part, infections plays a part, smoking, lifestyle, things like that plays a part. And I think we covered this in the last show,
yes,
where we said certain lifestyle changes have to take place in order to improve or protect your fertility.
In our previous chat, you mentioned that ISCI is a treatment for male infertility. Can you elaborate on that?
Oh, you're talking about ICSI, which is actually known as intracytoplasmic sperm injection. Well, you know, that is a treatment for male infertility. In fact, with the advent of ICSI, about 15, 20 years ago, male infertility, it doesn't exist unless there's absolutely no sperm left. But what happens in ICSI is that this egg collection takes place after a regular in vitro cycle. Egg collection takes place, and the eggs are then injected with a single sperm. We inject it right into what we call the cytoplasm. A hole is drilled into the covering of the egg, you know, into the membrane of the egg, and the zona of the egg, and then actually one sperm is immobilized and then injected right into the cytoplasm of the egg to ensure that fertilization takes place. So it is after that it is incubated in the laboratory for about 3 days, and when the embryo, day 3 embryo, is formed, we then transfer the embryo into the female.
Okay. And what are the possible causes of erectile dysfunction?
Erectile dysfunction could be, you know, hormonal, it could be neurological, it could be psychological, or it could be, when I say psychological, I mean, you know, a person may have a fear and which prevent him from gaining an erection. Neurological would be where he has some sort of a spinal injury. Vascular would be the same, you know, they say that impotence or erectile dysfunction is actually a sign of cardiac disease, because what they actually mean is that the vessels become atherosclerotic and they become narrowed with cholesterol plaques, and you don't get dilatation of these vessels. So they actually say that if a person is suffering from erectile dysfunction, one needs to have a cardiac checkup to make sure, because those are also capillary vessels. So it could be vascular, neurological, and it could be psychological. Those are the causes of erectile dysfunction.
Okay. And how long should a man abstain from intercourse before he goes for a sperm test?
Usually about 3 days, 3 to 4 days, but not longer, because sperm production is renewed every 4 days. So if you abstain for longer than 4 days, the chances are you'll get old or dead sperm. So it's ideal to be just about 4 days. After 4 days of abstention, followed by collection of sperm for sperm analysis.
Doctor, does age affect male infertility?
Yeah, that's a good question. I mean, you know, Charlie Chaplin fathered a child at 88. So generally, age doesn't really affect sperm production. But as one grows older, one does suffer from sometimes erectile problems, so which would contribute to infertility in the male. But generally, no, age doesn't really affect male fertility as much as it does affect female fertility.
Okay, and erectile dysfunction, how can that be treated?
Today, erectile dysfunction is eminently treatable. All one has to do is go to a urologist to rule out any physical causes of erectile dysfunction. One needs to be assessed psychologically to make sure there's no psychological element. But with drugs like Viagra, with Cialis, one can actually treat male erectile dysfunction very, very successfully. And there's also, you know, if all this fails, there's also a little injection. It's a prostaglandin type of injection, which they inject into the penis, and which gives adequate erectile function.
Okay.
So it's very well treated. It can be very well treated today.
And where can you get a sperm test?
A sperm test is done at any of the fertility clinics that are in Johannesburg. There's also a sperm bank that's in Parktown, where they do sperm analysis. And then there are, you know, the laboratories, the two big laboratories that we have in Johannesburg, which is Empath and Lancet. They all do sperm analysis virtually every day, and they do it by appointment.
And can sperm be stored for IVF?
Yeah, sometimes what happens is that, you know, especially people that are coming in from outside the borders of South Africa, the male and the female cannot come together because the male is involved with work. Then what we do is we collect the sperm for storage, and it can be stored for a long period. It doesn't really affect the quality of the sperm. And also there's lots of donor sperm today, which is being stored. So it can be stored. We also do, you know, we these days getting a lot of calls for HIV discordant couples that desire a family. Yeah, so we do a lot of that. In fact, there's a lot of that happening today. So what we do is we test the sperm, and then if the sperm is negative for the virus, we store the virus, and then we use that stored sperm either for artificial insemination with husband sperm or for IVF. So sperm can be stored for 25, 30 years without a problem.
Wow,
Yeah,
that's
so
a long
it can,
time.
Yeah, it's a long time. But it can be stored without really affecting the function of the sperm.
Okay. Thank you very, very much, Dr. Mohamed.
You're welcome.
I've learned so much. I'm sure our viewers have learned so much about male infertility. If you need to get that sperm test, make sure you get to that fertility clinic so you know what's happening. And doctor, they can reach you. Just let's recap again.
Or they can email us at info@sentonfertility.com.
Thank you for joining us again, Dr. Mohamed. If you have any comments, any questions or queries, you can email us at gma@planetimage.co.za. Thank you for joining me on Going Health. Enjoy the rest of the day, and back to you in studio.